The commonest cancer in Singapore is breast cancer to a woman. However, that involves gynecologic organs is ovarian cancer, cervical cancer, and uterine cancer in that order. Now, the incidence of ovarian cancer is on the rise, possibly because of rich lifestyle and less childbearing. It is now the fourth commonest cancer in Singapore after breast cancer, colorectal cancer, and lung cancer. Although ovarian cancer is common in older ladies, it can also occur in younger ladies. The symptoms of ovarian cancer include abdominal bloating, leg swelling, loss of weight, and constipation. However, very early ovarian cancer often has no signs or symptoms at all. The only thing that a lady may feel is some vague abdominal discomfort. So it is very important, if a lady feels vague abdominal symptoms after about a few weeks, to really seek medical attention. Ovarian cancer can occur in ladies as young as 12 years old and as old as 80 years old, and treatment really depends on what type of cancer it is. Not all ovarian lumps and bumps are cancer. It is important to distinguish the different swellings in order not to overtreat young ladies with normal ovarian cyst and not to undertreat older ladies with abdominal discomfort who may have ovarian cancer. Now, an ovarian cyst is a fluid-filled sac in the ovary. They can be present in the very young, even babies, to postmenopausal ladies. However, most ovarian cysts occur during infancy and teenage. Those hormonally active periods of development means that most of them are functional in nature and resolve with minimal treatment. Ovarian cysts, on the other hand, can also herald a malignant, or what we know as cancer process. It also may represent ectopic pregnancy, ovarian torsion, or appendicitis. When these cysts are large, persistent, or painful, surgery may be required, and occasionally resulting in the removal of the whole ovary. Ovarian cysts are usually asymptomatic and often an incidental finding during ultrasound performed for other reasons, but they can present as lower abdominal pain, which can be sharp, intermittent, sudden, and even severe. So it also can present as an abdominal swelling, especially in young, slim ladies. When ovarian cysts are discovered, it is important to go for a careful follow-up if the cyst is deemed not to be harmful. If the cyst is unusually complex or unusually large, then biopsy or removal of the entire ovary may be suggested. Surgical removal can be via an open method or through laparoscopy. Laparoscopy is a very simple procedure that can be done as day surgery. Sometimes blood tests can also be done. This is known as the CA125. If CA125 is raised, it can indicate a higher possibility of the cyst containing cancer. If cancer is diagnosed, then complete surgical staging and removal of the ovarian cyst may be required. Ovarian cancer is more common in postmenopausal ladies. However, as said before, it can occur in younger premenopausal ladies or even very young girls. The extent of the surgery would have to depend on what type of cancer it is. Malignant epithelial ovarian tumors usually require the complete removal of both ovaries as well as the womb. The surgery will also involve the removal of the omentum. This will allow full staging of the cancer to know the general prognosis of the cancer. In special cases such as borderline ovarian tumors, conservative surgery may be considered to reduce the morbidity and possibly even to conserve the fertility of a lady, should that be a priority for those ladies who have not yet completed their family. A type of ovarian cancer known as germ cell tumors occurs especially in young ladies. This type of cancer can be managed with conservative surgery even in very advanced stages. This is because the cancer is quite sensitive to chemotherapy, and the cancer can be cured with chemotherapy after conservative surgery. The chance of future pregnancy after treatment of germ cell tumors is very high. The most common type of ovarian cancer, however, still requires treatment with extensive surgery. otherwise known as optimal debulk of the cancer. The more the cancer can be removed successfully, the better the outcome of the cancer treatment. More than 60% of the time, patients present at the advanced stages, for example, stage 2, 3, and even stage 4. After surgery is performed, 90% of the patients would have to undergo treatment with what we call complementary chemotherapy. Why it is called complementary is that the treatment complements the surgery in an attempt to reduce the amount of cancer depositing and spreading in the abdominal cavity. This chemotherapy will consist of 6 cycles of injection given once every 3 weeks. About 1/3 of the time, ovarian cancer, when diagnosed, is already too advanced for surgery. These patients therefore undergo neoadjuvant chemotherapy before the surgery is done to reduce the size of the cancer before the surgery. The success of this treatment can reach 70 to 80%. About 1 in 5 patients who undergo neoadjuvant chemotherapy, during the surgery there is no visible cancer remaining. This treatment, however, cannot be recommended for all patients, as diagnosis of ovarian cancer is still best made after complete surgery at first presentation.